Good day, class. We're going to look at seizures, strokes, diabetic emergencies, breathing emergencies, and poisoning through the next week or two. Today, we're going to look at some breathing issues. So we'll talk a little bit about asthma. We'll talk a little bit about food allergies. So let's look at the first part of this. Remember, again, to email me at any time. My name is Mr. Grove. I wish you the best. We'll work through this together. Wish we were in class and then we could just comprehend so much more. But that being said, we're going to deal with this. We'll get through it. So let's watch about 15 minutes and we'll have a little bit of a questionnaire at the end. Probably look at 2 videos. So here we go.
To the untrained eye, these emergencies may be tough to spot. For example, sometimes a person suffering a diabetic emergency might just look tired or confused. Rather than just writing off odd behaviors, it's your job as a first aid responder to recognize signs and symptoms of a sudden illness in order to respond and give appropriate care. While there are specific signs and symptoms for each type of sudden illness, there are some more general things to look for. Changes in levels of responsiveness. This could mean the person is confused, unaware of surroundings, or simply not alert. Call 911 if the person becomes unresponsive, has trouble breathing, chest pain or persistent abdominal pain, severe burns or swollen or deformed areas, vomits or passes blood, is suspected of ingesting a poison, or suffers a stroke or seizure, or if the person is suspected of an injury to the head, neck, or spine. The general rule is, when in doubt, call 911. Until help arrives, your primary goals are to care for any life-threatening conditions, help the person rest comfortably, and watch for any changes in breathing or responsiveness. Always remember, no matter what sudden illness emergency you're responding to, use the check, call, care process to respond quickly and effectively.
Looking at a few of the briefing summaries, today we're going to look at one of those where it's going to be a type of a breathing emergency where a person has an allergic reaction. If you recall back in school, through your, whether it was your elementary, middle school, high school years, allergies, peanut allergies, whatever it may be, bee stings, certain individuals had severe reactions. So we're going to look at a reaction today with a food allergy. I hope.
More severe, such as anaphylaxis. Anaphylaxis is a life-threatening reaction where the airway can swell, making it difficult to breathe. If not treated, it could ultimately lead to death.
Look at this situation.
Are there peanuts in this sauce?
I thought you checked. Oh no. Did you eat any yet?
Yeah, I did. Oh man.
Are you okay, Art?
I don't know. Oh, my throat is swelling. Art is showing signs and symptoms of anaphylaxis, which can be a combination of difficulty breathing, wheezing or shortness of breath, a tight feeling in the chest and throat, swelling of the lips, face, throat, or tongue, or weakness, dizziness, or confusion.
It's going to be okay. Do you have your epinephrine auto-injector?
Since Art had an epinephrine auto-injector, he used that to counteract the effects of the anaphylaxis. If the person has one on hand, use it as soon as possible, instead of delaying care to call 911. Before helping a person suffering from anaphylaxis, be sure to confirm a history of severe allergies, look for signs and symptoms of anaphylaxis, find out if the person needs help administering the auto-injector, and check that you have the person's own prescribed auto-injector. It is also important to be familiar with your state laws related to helping with an epinephrine auto-injector.
How do you feel?
A little better, thanks.
I'm calling 911.
When a person is suffering from anaphylactic shock, call 911 if the person has trouble breathing, complains of the throat tightening, explains that he or she is subject to severe allergic reactions, or becomes unresponsive. While waiting for EMS to arrive, Candace will monitor Art's breathing and for any changes in his condition. If the symptoms persist for 5 to 10 minutes without EMS on the scene, a second dose of epinephrine is advised.
our next segment is going to be a little bit about a person that's diabetic or diabetes. We'll follow situations. Some of you may have relatives that are diabetic, family members, or friends. So it's good to know some information in relationship to how you would treat this situation. Here we go.
Ability of the body to change sugar, also called glucose, from food into energy. A diabetic emergency is caused by an imbalance between sugar and insulin, a hormone that regulates glucose levels in the blood. There are two types of diabetic emergencies, hypoglycemia and hyperglycemia. Simply put, hypoglycemia is a case of too little sugar in the blood, and hyperglycemia is the opposite, too much sugar in the blood. Both have similar signs and symptoms: changes in mood and levels of responsiveness, rapid breath, feeling and looking ill and dizziness, headaches, or confusion. Hyperglycemia generally comes on more slowly than hypoglycemia, which can come on quickly and unexpectedly. If you think someone is having a diabetic emergency, whether it's hypo or hyperglycemia, it's best to give the person 15 to 20 grams of sugar in the form of their own glucose tablets, or if not available, candy that can be chewed, orange juice, fruit leather strips, or milk are good alternatives. Only do this if the person is awake, able to follow simple commands, and safely swallow.
Have the opportunity to read through the briefing. Be careful when you make sure the person's conscious and it can talk and not be confused in reference to administrating any part or information in regards to grams of sugar, whether it's glucose tablets or candy. A lot of times the individual will say, I need a soda or orange juice, fruit. Those are other substances that you could administer. Make sure you communicate that and you understand that. I'm going to pause it a second. Okay, at this time, we're going to look a little bit about asthma. And then also I'm going to have some questions that if you pay attention, they'll really directly relate to the questions that'll be at the end of this video. We will have two videos today, this presentation and another video that will describe some situations dealing with our information. Preventing asthma attacks. Asthma, when it inflames, and I'm going to give you a definition of asthma, is a lot of times a lifelong disease which certain substances or conditions, they're called triggers. We're going to look at the triggers today. They cause inflammation, constriction of the airways, definitely the small tubes in the lungs through which we breathe, making it difficult to breathe. The triggers of asthma attack include some of the following we're going to look at. So what do we want to limit? How do you prevent this person? Because it could be a lifelong situation where you have asthma. Keep plants, if you have a reaction to those, outside. Wash your bed clothing off. Don't be around a lot of smoke, a lot of inhalants. Eliminate pets. Can make sure you wash, give your dog a bath, cat, whatever it may be, can cause asthma. Control your emotions. We know that emotions can trigger asthma attacks, such as fear. Reduce those chances. So how do you prevent some of these things? Well, one is with fears, or you get hyper excited and you count to 10. Breathe in through your nose. Exhale. Those type of things. We look at hyperventilation, very similar. Try to relax yourself. Take those deep breaths. Count to 10. Some people, when they do hyperventilate. But let's look again, some other prevention. How do you reduce environmental triggers? Wear the right clothing for weather conditions. Stay indoors on days where there's high risk of respiratory issues for asthma. Take preventive medications that are prescribed possibly from your medical physician. Stay away from places where there is high amount of dirt and smoke. Know how the weather affects your condition. And also talk to your healthcare provider what other strategies you can use. Exercise. We know that exercise can help. Slowly warm up to get ready for your exercise. Cool down slowly as well. Drink plenty of fluids during exercise. And if you're in a team's type of sport, or notify your coach or your athletic, your physician, it could be your athletic trainer, that you do have asthma. You may have an inhaler and certain things that may trigger. We're going to pause at this time. So what do we want to do in care for respiratory distress or respiratory arrest? We always go back to the check, call, care. So check the scene to ensure everybody's safe, you yourself, as well as the person that you're going to be dealing with or people. Check the person for consciousness. If the person is conscious, you know that he or she is breathing and their heart's beating. One thing I do want to mention here, and the timeline for respiratory distress and respiratory arrest. When respiratory arrest occurs, means you're not breathing and your heart is not beating. You have about 4 to 6 minutes where the brain damage is possible. 6 to 10 minutes, brain damage is likely. Over 10 minutes, a lot of times it's irreversible brain damage. So it's important that we understand through this unit what CPR will do for us, what mouth-to-mouth will do for us, how to, if an obstructive airway, how to clear it, and the benefits. So we're at 11 minutes and 48 seconds. I have 15 minutes on this video. Going back to that check, call, care. Again, check the scene, check the person for consciousness, call 911. Continue to check for life-threatening situations. Care for conditions you find. Here are some questions for today. I'm going to pause. The following study questions, see how you would answer them. I will answer them for you right now. So there are 11, and I will mention there's probably going to be 11 on some type of quiz at the end of this video. First, blockage of an airway that prevents air from reaching a person's lung is airway obstruction. Second question, study question. A condition in which breathing stops is respiratory arrest. 3. A condition in which breathing becomes difficult is respiratory distress. 4. Bluish discoloration of the skin around the mouth and or on the fingertips. This is called cyanotic. That's a good thing to look for when a person is not breathing and hasn't had blood circulation. Nail beds, as I mentioned, skin around the mouth, and look at the fingertips, bluish. Next question. Occurs when the airway is blocked by the tongue or swollen tissue of the mouth and throat, and this is anatomic airway obstruction. And you'll see people clasp at their throat, get excited they can't breathe, and hyperventilate. The next questions. Which of the following is a signal of respiratory distress? I'm going to give you the answer. It's going to be gasping for air, breathing that is slower than normal, wheezing. So all those above. Next, I'm going to speed this up. How are asthma and hyperventilation and anaphylactic shock alike? They are forms of respiratory distress. Care for a person for respiratory distress always includes which of the following? Helping the person rest in a comfortable position. Number 8, while eating dinner, a friend suddenly grabs at his throat and appears to be trying to cough. What this would be you would give back blows, abdominal thrusts. Sometimes we look at back blows, maybe not, but definitely abdominal thrust. We're going to learn that. Next question. A woman is choking on a piece of candy but is conscious, coughing. You would encourage her to continue coughing. And with 10 seconds to go, what should you do for a conscious infant if they're choking and give back blows and chest thrust. We'll look at that later.